Imagine holding a crystal no bigger than a grain of sand, yet it can bring you to your knees in pain. That is a kidney stone. The surprising truth is that many stones can be prevented, and some small ones can be passed naturally without surgery. In this guide, you will learn the science, the lifestyle strategies, and the day-to-day habits that can keep your kidneys clear and your life pain-free. Understanding the enemy. Kidney stones are hard mineral deposits that form inside the kidneys. They are made up of salts and minerals, most often calcium oxalate. They develop when your urine contains more crystal-forming substances than the fluid can dilute, which is why hydration becomes your first line of defense. Visualize a glass with sugar at the bottom. If you keep adding sugar, it eventually piles up. But if you keep pouring water, it dissolves away. That is exactly how hydration works against stones. According to the National Kidney Foundation, about 1 in 10 people will have a kidney stone during their lifetime. The encouraging news is that most stones under 5 millimeters can pass naturally with the right support. The non-negotiable water. The simplest and most powerful remedy is water. Not tea, not soda, not juice. Just plain, clean water. The goal is to drink enough so your urine stays pale yellow throughout the day. Evidence from research in the American Journal of Kidney Diseases shows that higher fluid intake significantly reduces the recurrence of kidney stones. In other words, every extra glass of water you drink is an extra layer of protection for your kidneys. If you think you are drinking enough water, check your urine. If it is pale yellow, you are on track. If it is dark, you are falling behind. Your body gives you the signal every time you go to the bathroom. Citrate, your secret ally. Lemon juice is not just refreshing. It contains citrate, a natural inhibitor that helps prevent calcium stones from forming. Squeezing half a lemon into a morning glass of warm water and sipping slowly can be a simple yet powerful ritual. A study in the journal Urology found that people who added lemon juice to their daily routine had fewer new stones form. Think of it as adding a key to your body that stops the tiny locks of stone formation from snapping shut. Herbal support. Certain herbs have been used for centuries to support kidney health. Basil contains acetic acid, which may help break down small stones and ease pain. Dandelion root acts as a mild diuretic, increasing urine flow and gently flushing the kidneys. Horsetail tea has anti-inflammatory and antioxidant properties while encouraging urination. These are not instant cures, but they can be gentle, consistent allies when included in your daily rhythm. A cup of herbal tea mid-morning can become both a comforting habit and a preventive measure. The apple cider vinegar trick. Apple cider vinegar contains acetic acid, which may help soften stones, making them easier to pass. A small amount, about 1 to 2 teaspoons mixed into a glass of water in the afternoon, can be incorporated into your day. Always rinse your mouth afterward to protect your teeth. Some observational studies suggest it can help in certain cases, but it works best when paired with hydration and dietary awareness. Apple cider vinegar is powerful, but more is not better. Overuse can harm your teeth and stomach. Think of it as a gentle nudge rather than a heavy hammer. Move to move stones. Light physical activity, such as walking for 10 to 15 minutes, can help small stones shift through the urinary tract. Gravity and gentle motion can make a difference. A study in the Journal of the American Society of Nephrology found that physically active people had fewer stone recurrences than those who were sedentary, likely due to better overall metabolism and kidney function. Imagine a marble in a straw. If you tilt and move it gently, it will eventually slide through. Rethink your plate. Your daily diet plays a direct role in stone prevention. Reducing sodium helps keep calcium levels in the urine balanced. Moderating animal protein, particularly red meat, can lower uric acid levels. Being mindful of oxalate-rich foods like spinach, nuts, and beets is especially important for those prone to calcium oxalate stones. Pairing these foods with calcium sources like yogurt during the same meal can bind oxalates in the gut before they reach the kidneys. A daily routine for prevention and support. Begin the morning with a glass of warm lemon water, followed by plain water. By mid-morning, enjoy a cup of herbal tea made from basil or dandelion, along with a small fruit snack. At lunch, aim for a balanced plate filled with vegetables, moderate amounts of lean protein, and minimal salt, with water on the side. In the afternoon, drink a glass of water with a teaspoon or 2 of apple cider vinegar, followed by a short walk. In the evening, Choose a light dinner with low salt and moderate protein, and check in on your hydration levels. Before bed, have a small glass of water to finish the day. When to see a doctor? Even with the best natural support, some stones are too large or complicated to pass. Seek urgent medical care if you experience severe and unrelenting pain, fever, chills, blood in your urine, or difficulty urinating. Ignoring these symptoms can lead to infection or permanent kidney damage. Mindset shift. Instead of thinking about kidney health only when there is pain, view it as a daily practice. Hydration, balanced meals, and gentle movement are not just stone prevention measures. They are investments in your overall well-being. Prevention is not boring. Every glass of water is an act of self-protection. Every lemon slice is a small dose of natural medicine. Every walk is a step toward longevity. The science-supported payoff. The combination of adequate hydration, mindful eating, and gentle herbal support has decades of research behind it. In the long term, these habits can reduce the recurrence of kidney stones by up to half, improve kidney filtration efficiency, and maintain a healthy urinary tract. The vision. Picture yourself 5 years from now. No emergency room visits for stabbing back pain. No sudden fevers from infections. No sleepless nights curled up in agony. Instead, imagine a daily rhythm that is simple, nourishing, and protective. This is the power of small, consistent habits. Every sip, every meal choice, and every walk is part of a quiet yet powerful defense system your kidneys will thank you for, not just today, but for the rest of your life.